Speaking is Antonio Grasso, Public Affairs Director at the European Digital SME Alliance, and I'm very happy to kick off this meeting because today we want to launch a community of innovators that can put their digital solution and their skills at the service of public health objectives and of the sustainability of healthcare systems in this continent. It's at least since the onset of the pandemic that the digitalization of health systems has fostered the capacity of bringing on efforts to shift the paradigm in healthcare towards patient-centric health systems that are the best place to respond to public health challenges in a more sustainable manner and to fully realize universal access to healthcare. The health system has been one of the main sectors that has been digitized through data-driven innovation. And since this has been booming, the European Union has undertaken key initiatives to foster the digitalization of the sector. And clearly, one of the examples is the European Health Data Space that we are gonna talk shortly about. Today, we wanna discuss with two distinguished panels of distinguished guests about the opportunities to close the data gap and the challenges and opportunities in the digital transformation of healthcare systems, and to promote the modernization of patient experience in the health sector. So on the European Health Data Space, it's a crucial week to discuss this topic because it's the week where the negotiations are brought on, and it's a crucial dossier to disclose the opportunities that come from data sharing and data-driven innovation in Europe, because it is a key component of the European strategy for data. It holds the potential to unlock the value of data and ultimately to be a powerful enabler for the benefits of the patients and public authorities, and it can contribute to build upon innovators to provide a robust, consistent, and harmonized European technical and governance framework for health data. It's a network also of health data sharing that has the potential to lower the barrier for those European small and medium innovators that want to use and reuse high-quality data sets for research and innovation purposes, and that also want to make innovative services, for instance, in the area of telemedicine, to support public authorities and to improve the quality and the accessibility of healthcare services in Europe. So to kick off the discussion and to learn more about the status of this crucial dossier for the future of data-driven innovation in healthcare, we are honored to have today with us one of the leaders of this initiative, the rapporteur of the European Health Data Space in the European Parliament, Honorable Member of the Parliament, Tomislav Sokol, and I'm very happy to hand over the floor to you, Mr. Sokol, to give us a keynote address.
Thank you very much. I hope that you can hear me and see me. I have to apologize because I will have to leave right away after giving my introduction because I have to catch the train to go from Strasbourg to Brussels to hopefully the last negotiations on the health data space, and if we are able to achieve a breakthrough, then today we should have an agreement today in the evening. But this is the reason why I will have to leave very soon, not to be late for the trialogue with the Council and the Commission. So about the European health data space, it's one of the few initiatives where we really create something new on the European level. So the problem with health data is that we have enormous amounts of this data in all member states of the European Union. Actually, according to some studies, this is the sector which produces the biggest amount of data. But this data is not systematized, it's not categorized in many cases, not utilized, and not shared between different member states, and often not shared even within the same member states, between different healthcare providers, between different hospitals or universities, etc. So this is something that we have to change. There is an enormous potential of health data also for patients when they travel, for instance, abroad or travel to another part of the country to get treatment without duplication of diagnostics, of tests, etc. But also an enormous potential in terms of gathering data for research and innovation. We know that Europe is lagging behind the US, and also in the last couple of years, also China is picking up pace. So we are lagging behind in terms of research and innovation. New medical technologies are being developed elsewhere. And this is something that we need to change if we want to be competitive on the global market, but also if we want to be less dependent on import of, for instance, medicines and new medical technologies from other parts of the world. So the idea of the health data space is to tackle both of these things. So to provide better healthcare, but to also to utilize the unused potential of all this data for health research. And in that sense, we divide European health data space into two dimensions. One is so-called primary use of data, and the other is secondary use of data. Primary use of data is use of data by healthcare professionals. So this essentially means, in practice, that all of our health data will be put in one common European digital format, European electronic health record. This will be available online via, for instance, application via your mobile phone. And when you travel abroad, or when you travel to another part of your country, to another city, which is not the city of your residence, or if you live in a federal state, you go from one part of a federal country to another. Like for instance, if you go in Germany from Bavaria to Berlin, this data will be with you. Let's say so. This data will be available to healthcare professionals. So when you go to another city or another country and you need to see a doctor, they will be able to see in their own language all of your health data, which means that they will be able to see whether you need certain treatment, whether you have already undergone certain tests or diagnostics, so that they don't have to repeat it, whether you are allergic to some medicines, you are already receiving some treatment or medicine, etc. So the whole idea of this is that doctors can provide much faster, much better, and much more efficient health treatment without duplication, without need to wait to undergo some things again, and also definitely the room for mistake by healthcare professionals is much smaller, because they will be able to see your health data right away. So this is of course something which will benefit mostly people who are mobile, who travel, but also, as I said, within the same member state, this data will definitely make it possible to go to different healthcare providers, different hospitals, etc., and to get treatment in a much faster and better quality way than it is now. Of course, what is also important is that by doing this, that in primary data, we are also strengthening the patient's right to control their data, which means that if a patient does not want his or her data to be available to all healthcare professionals who are treating him or her, they will be able to limit this. So, for instance, if you have some psychological issues, you may want to limit access to this data only to your psychiatrist and not to your general practitioner, for instance, or to some other doctor who is treating you for something else, etc. Also for sexually transmitted diseases or things like that. So essentially, patients will be in full control of their data, and they will decide who will be able to access this data. Also, member states, since healthcare is primarily a national competence, will be able to also determine what are the possibilities for patients to object of the use and sharing of their data for primary use in general. So in that sense, member states will have freedom to also regulate this in more detail. So this is not that controversial. In the negotiations, the question was obviously about the actual division of powers between the European level and member states, but essentially this is not very problematic. What is more problematic, more controversial, more sensitive, is secondary use of data. So secondary use of data is the use of data which has already been gathered for other purposes. For instance, for policy making, for research, for innovation, and things like that. So this is more controversial because there are different points of view in terms of who should be able to access this data, whether this should be limited only to for instance, public providers, public universities, or also for private companies, for which purposes, etc. So what we did, what was my approach in the parliament, is that this should be used not just by public institutions, but also by private institutions if they are conducting research and innovation which is beneficial for public health and which is there to benefit the end users, meaning the patients. Because we need also the private sector to develop new medicines, new medical technologies, and all of this data can definitely also be used for that purpose. What we don't want, however, is that data is used for other purposes other than healthcare. So, for instance, there were some concerns that big tech companies will be able to take our health data and use it for social media profiling, for developing lifestyle applications and things like that. So this is something that we don't want. So what we want is to narrow down the purposes so that it is clear that this can only be used for public health reasons. So this is what is the Parliament's position. That this was my position in my amendments. In my report, I went for a strict definition of the purposes for which data can be used, so to limit this to really public interest and public health. Let's maybe try to be more concrete, not just abstract. So this would mean essentially how this would work. So a certain hospital which has many data sets of different on different diseases, on different treatments, etc., will have to catalog the data sets that they have. They'll have to publish the existence and titles of these data sets so that somebody from other member state, for instance, so let's say that this is a hospital in Rome, so some researcher from Berlin, Paris, or Prague, for instance, will be able to see that there is a data set in Rome which can be useful for research on cervical cancer, for instance. They will make a request to Italian Health Data Access Body, where they will have to justify the need to use this data. And if Italian Health Data Access Body, so public body, determines that conditions are fulfilled, then the researcher for Prague will be able to access this data in a secured environment. So we are speaking about access in a secured environment. Nobody will be able to download this data and take it with them. So the idea is that this is only done for this very specific purpose, only within a secured environment, within the full control of public bodies. So with all of these safeguards, we believe that we will be able to achieve the purpose of this, and this is to really use data for research, for innovation, and essentially for saving lives. What is also the biggest point of contention here, obviously, is the role of the patients. So the role of the patients in deciding how their data will be used and whether it will be used or not. And here, in the Commission proposal, we had nothing on that. So the Commission proposal essentially left this to the member states and how they interpret the GDPR, which I believe is definitely not the best solution because this would create enormous legal uncertainty. So to prevent this from happening, we introduced a so-called opt-out. So that those patients who do not want their data to be used for secondary purpose for any reason whatsoever, they can decide to do so. So they can say that I'm opting out of the system, so my data cannot be used for secondary purposes for any reason whatsoever. I don't trust public authorities. I don't trust pharma industry, whatever. There were some ideas that we have to have a consent-based system or an opt-in system whereby patients would have to each time make a proactive decision to share their data for secondary purpose, but I was against that because that would not have worked. And we have the studies which show that with an opt-in system, you have data which is much more biased and less representative than if you have an opt-out. Because essentially only have certain categories of population who are interested in sharing their data to do this proactively, to opt into the system. And if we accepted this would have been, I would say, the end of the HDS. So we believe, and I believe that what we have on the table now, what the Parliament voted for, that is the opt-out for secondary use, is the best way how to strike a balance between the need to have representative useful data on one side with the need to protect patient choice and patient privacy on the other. This is also the main point of contention with the parliament with some other issues, but this was the one that took up most of the time because member states were in the beginning very reluctant, to say the least, to have a harmonized opt-out, and many member states wanted to have a system where each member state would decide what kind of system to have. So in that case, some member states would have had an opt-in system, some member states would have had an opt-out, some member states would have had nothing at all. So this fragmentation is what we wanted to prevent. And we are now negotiating. So we are close to an agreement whereby we will have a harmonized system, so a common European opt-out with certain very specific exceptions for the member states where they can override this opt-out for certain public interest purposes, for instance, in cases of emergency and things like that. So this is the idea. This is what we are negotiating on now, and I hope that today we will be able to find the agreement. So how to strike the balance between the patient's data protection on one side, the need to have useful data on the other, and also to have a system that works, which is not fragmented, and which is a common European system and not 27 different national systems. Apart from that, there are other things as well. So what both Parliament and the Council want is to have more funding from EU level for this in the next MFF because there will be an enormous need in some member states, in many member states who have not developed their digital systems to build the infrastructure, to train people, etc. So for that, we will need more funding from EU level, and we will definitely fight for that. And we also have to find a balance for the timeline of the implementation. So member states want a bit more. Longer timeline for implementation, Commission less, so we will probably find some middle ground. But the idea is that these deadlines for implementation are realistic, but they are also not too long. And I think that we'll be able to find a compromise on that. Yes, also one thing that I wanted to emphasize is that we will have simplified rules for secondary use for micro enterprises, so up to 10 people, so up less than 10 employees. So the idea is, for instance, for individual medical healthcare practices like GPs, etc., that they don't have to fulfill the obligations of sharing data for secondary use, because we know that this will have imposed an enormous burden upon them, an enormous administrative burden. So we wanted to make it easier for them, but in the end, member states will be the one who will decide, depending on the context of their healthcare system, whether to apply this exception or not. But we in the parliament definitely wanted to make it easier for at least micro enterprises, so that they don't have to do all these things which are more natural for big data holders like hospitals, universities, etc. But in the end, member states will be the one who will have the final say on that particular topic. But it is important for us, and Parliament will definitely fight for a solution that will not impose too much of an additional administrative burden on at least micro enterprises, individual healthcare practitioners, etc. Okay, so this is all I had to say at this point. Again, I have to apologize because I have to run right away to get to Brussels for the negotiations. Thank you very much for inviting me, and I'm also open to any kind of future suggestions or comments or meetings if somebody wants to get additional information on EHDS, and I look forward to future cooperation. Thank you.
Thank you so much, Mr. Sokol. We appreciate a lot that you took the time to speak to us today, and we appreciate the inputs you have shared, including the possibility for the opt-out and also the point that you last touched upon about not increasing the burden of the legislation on SMEs that are those that we represent. So we really would like to thank you for your highlights. We will surely keep in touch, and we wish you the best for a successful conclusion of the negotiation on this very crucial initiative to foster data-driven innovation in Europe. Thank you so much for being with us today. So we are then moving on, thanks to the MFP Sokol for having set the ground for our discussion. We are moving on with an excellent set of panelists for our first discussion on the challenges and opportunities that unfold from digital transformation of the healthcare systems. And I'm very happy to introduce today the panelists of this discussion. And I would like to start with Eric Sutherland, that is a senior health economist at the Organization for Economic Cooperation and Development, the OECD. And I would also like to introduce our other two panelists that are Ioana Nego, coordinator of the Digital Health Working Group at Cluj IT, a crucial innovation cluster in Romania that the European Digital SME Alliance has the privilege to have in its membership. And last but not least, I would like to welcome as well Elena Malinina, data director at EURARDIS, the European representation of rare disease patients. Thank you so much to all of you for having accepted our invite and for being here today. To kick off our discussion, also taking stock of the address that MFP Sokol has done, I will go first to Eric to ask from the OECD perspective and work on health data governance recommendation, how do you consider that digital health and the insights that come from the work of the OECD can support policymakers at different levels, and how do you see that policymakers are implementing into practice the recommendation that the OECD has put forward within the health data governance framework? Eric, over to you.
Well, thank you very, very much. I trust that you guys can hear me well. I first want to reflect on what we just heard, and if the minister was still on, I would begin giving him a hearty round of applause. I think that not only the approach that he talked about for the HDS and the fact they've actually got it to the point that it is exceptional, but the specific areas that he was highlighting during his remarks, I thought were exactly the types of things that need to get addressed. And I'll actually reflect on that a bit in my own thoughts from the OECD's perspective. So I'm very happy with that direction. We'll reflect again what the minister was saying. I actually have a statistics that is 30% of the world's data is in health, and so yes, the data globally is dominated by health, almost a third of it, and yet only 1% of that data are actually used for decision making, which implies that 29% of the world's data assets, and if we submit that data has some fundamental value, 29% of the world's data assets are actually unused to achieve, better health outcomes for people. So in my mind, I think that is a major part of where digital innovation, the European health data space, artificial intelligence, all come together to try to unlock the fundamental value of the massive set of data assets we have within health, as well as to actually enable the broader assets or broader insights that we're able to make when we start to link that data with other social determinants of health and other areas that are important, such as climate or education. So I think from that perspective, it's really where the OECD came into this back in 2016, so almost 8 years ago now, where we published our recommendation on health data governance, or rather the OECD countries agreed to a coherent approach around health data governance. And that work in and of itself really identified, I'll call out 4 important areas. One was the importance of involvement of the public and providers in the design of your practices around health data governance, because the public and providers are obviously the groups that are most impacted by digitalization and the use of health data, and thereby they should have some sort of say in the work of that. So you guys know a second study that we're doing, we haven't yet published it yet, is health providers aren't as worried about disruption of their jobs because of AI, but they are worried about the disruption of their jobs by AI when they are not involved in development of those AI solutions. And so really it's about how do we make sure, if we want to get adoption of some of these new innovations that we have coming up, designing it with the people who are going to be using the solutions, who are impacted by the solutions, aka the public and providers, I think is absolutely essential. And so that would be some suggestion I would certainly provide for this community as it directly impacts you. The second thing I will call out is, from the OECD's perspective, it really highlighted the importance of data protection, not surprisingly, and that data protection obviously in the form of both security as well as privacy, ensuring that the policies and processes are in place to make sure that the data were protected. Obviously, very much aligned, as it turned out, like the global data protection regulations took from that. Having said that, there's also provision. So the third thing I would call out about the OECD recommendation is it emphasizes the importance of the use of data. And that's where establishing a policy environment wherein data are used and available on a timely basis with good quality for uses and primary purposes, or, as frankly we just heard, around various secondary purposes, is absolutely essential. And I would submit that this is the area where many OECD countries have had the most significant challenges. I'll cover that after I go through the last point. So the last point I was going to call out about the health data governance recommendation is it actually explicitly talks about the role of consent or appropriate alternatives. And actually, in my experience, the exact way that I think that consent should be designed is in fact the way the HDS is going, of having an opt-out wherein there is understanding that there are cases where the opting out does have an override. There are scenarios, if I quote from the United Kingdom, and they're Caldecott principles in the previous version of the principles, because I thought the wording was really good. There are times when keeping data private is more important to provide access to data than it is to keep the data private. And so recognizing that that tension exists and resolving that tension through very clear guidance for policymakers, for decision makers, for analysts, and frankly for innovators, I think is absolutely essential. So if I go to the question about how OECD countries are doing in this space, we did a report in 2022 talked about the 5-year assessment of how OECD countries were doing, and I'll say the results were mixed. Many of the Nordic countries did quite well, specifically Denmark and Norway and Sweden. Sorry, Denmark, Finland, and Sweden, as well as Korea. Where they were establishing the foundational environment of data and digital policies that really foster the timely collection of data for its use by various policymakers. Having said that, there are many other countries that did not have that capability in place, that they may have had various registries, but the ability to link data across data repositories was limited. Or simply many countries didn't even have something as, I'll say, as foundational as a digital identifier to enable the linking of data across various health encounters. And so those are some of the things that are absolutely essential as we move into the next wave of digitalization, especially with the European health data space, as some of the foundational capabilities that they will require. Just to give you guys a picture before I close in your heads, I found when I arrived at the OECD a year and a half ago, my background was really around the data side of things. Having said that, my role is digitalization of health systems. And one of the important things that I came to realize very quickly is that there are various parts of the ecosystem that must work together. We must have the digital technologies that carry and transport and produce the various health data that we create, and then we must have the analytics that turn those data into actual meaningful and actionable insights. And so simply put, we need the pipes, we need the water, and we need the taps, where the pipes are the technology, the water are the data, and the taps are the analytics. And all three of those things need to be designed together with the humans who will actually oversee and guide and manage that ecosystem itself. And so from a policy perspective, I think from when I sit at the OECD and I look around, I think there's great opportunity. I think everyone is taking things seriously in this space. Having said that, I think that many countries still have a ways to go because, frankly, from a cultural perspective, they have been focused very much on data protection, interpreting it as protecting the data. And this shift, and this is where I think the European health data space really drives a conversation that it is important to protect the citizen, not the data. Not to say that you don't protect the data, just say protect the data, protect the citizens with their data, as opposed to protect citizens from their data. So I think that's a cultural shift that we're observing. I think the way the HDS legislation as is framed is going to help drive in that direction. So I will leave it there and happy to continue later on.
Yes, thank you so much, Eric, for these insights that are crucial and very interesting, especially when you mentioned in the beginning that there are still missed opportunities when it comes to using data assets in the world. It's quite striking, the percentage you mentioned on what still needs to be done to take all the opportunities that come from data to drive innovation and improve healthcare services. And among the other things, also what you mentioned last, that is important to protect data in order to protect citizens, is also an objective that the European SME community shares, because the innovators that we have in Europe are willing to bring innovation to the market in line with the European values. The human-centric digitalization applied to the healthcare sector is even more important because healthcare is a common good. And so we need to put the human and the patient aspect at the center of this. And to go towards that perspective, we are indeed very happy to have Yelena with us today. And I'm going to you, Yelena, to ask from the patient perspective, how do you see that data-driven innovation could support the fostering of a patient-centric approach when it comes to health systems in Europe and beyond? Over to you, Yelena.
Thank you very much, Antonio. Yeah, it certainly has a lot of promises throughout the patient journey. So we can look at diagnosis, treatment, and care on how they could be much more patient-centered thanks to different types of technology and innovation. So for instance, if we're looking specifically at the context of rare diseases, but I believe it's not only the case for that community, but it's just one of the striking examples that on average, it takes 5 years, at least 5 years for many people, and for some, many more years to receive diagnosis. And a lot of people have to visit more than 4 healthcare professionals before they receive some kind of guidance of what could they have. So as you can imagine, behind these numbers, there is a lot of frustration, possibly of not knowing what happens to you or very often to kids, because rare diseases, very, very often they are seen at very young age. So a lot of parents might struggle to even get a diagnosis or even some kind of direction of what could be wrong with their child. And of course, with digital technologies, different types of predictive analytics, we can hope that this number would be not as huge. We hope for a reduction of years. Hopefully, one day it's months or days or much smaller period of time when people can receive diagnosis. Also, it can support enormously general practitioners, because very often it's the first healthcare professional which people visit with any types of health issues. And it's, of course, not possible that general practitioners know about every type of rare disease, because there are thousands of them. Some of them are not even known. So it might be quite difficult to know the right direction in there. And other opportunities are linked, of course, with telemedicine, different types of remote consultations between patient and healthcare professional, but also healthcare professional and healthcare professional, which is also proven to be very, very useful in case of difficult cases, rare conditions, when specialists can just easily connect somewhere around the globe with each other and consult each other. This is also something which exists already for rare disease through European reference networks. These are online networks mainly, which connect different type of healthcare professionals specialized in more rare conditions. We can also speak, of course, in the future for different type, more of personalized treatment, personalized medical devices. We're not there yet, but this is the direction which we are moving together with opportunities technologies offer us. Overall, I think digital technology can lead to quality of healthcare services simply because it's easier to measure different types of KPIs and how the technology is functioning and how services are performing. So overall, we might have a much better picture on how to improve healthcare service in a given country or in a given region, hospital, and so on and so forth. And of course, we should not forget that digital technologies lead to better patient engagement and education. Once again, it's quite simple, but many patient communities are able to communicate with each other and with different types of professionals, receive different types of capacity building programs, skills, and so on and so forth through digital means. So this is a big step forward. And I think one of the most important things in all that, and maybe it will not sound as fancy, but it's the ability to access your own data, which is enormous, which is not sometimes possible through paper record. Papers get lost, sometimes it's insufficient. And a lot of power lies in data access, also for patients, for healthcare professionals, and anyone who is involved in healthcare service provision. Yeah, I think that's it from my side. Thank you.
Thank you so much, Elena, for these insights. And indeed, it's not a less important aspect, the fact that patients should be able to access their data. We know this is still a challenge in many parts of Europe. So we hope that through the development of solutions from the European innovators, we can also support the patients in overcoming these challenges in line with the European values, in line with the European regulation when it comes to data protection and respect of the confidentiality of the patient data. So now to go to the side of the innovators, because one of the crucial aspects when it comes to a patient-centric healthcare, and when it came to dealing with public health emergencies such as the pandemic, was the proximity to the patients and the proximity of healthcare services. So I'm going to Ioana to ask how from a cluster, a regional cluster of innovators, given your expertise as a coordinator of the Digital Health Working Group of this cluster, could you please share how companies interact with other actors in the healthcare quadruple helix, including indeed healthcare providers and patients? Ioana, over to you.
Thank you very much for the invitation. It's a great honor for me to represent here Cluj IT Cluster and also to be able to share a little bit of what we are doing together in the ecosystem. I would like to continue the idea of Elena and underline the fact that the quadruple helix actually it's a new form of cooperation that it's derived from the triple helix that initially included the academia, SMEs, and governance. And with the addition of patients association or other non-governmental societies, this brought, I think, what is the main point of all the discussion today. It's how we deal with all the health data of patients, but not only of patients, also of healthy people that are interested in participating in many European projects. Let's remember the European project Plus 1 Million Genomes, where many countries are involved, many patients, many people as volunteers are involved there. And actually this brings us the attention to what an ecosystem has to look like. So in my opinion, what means really innovation usually comes from academia. Of course, here we need to collaborate because we are in the health system. We need to collaborate in everything what means translational knowledge with hospitals that actually provide us the access to the patients. And considering what is an unmet clinical need for many diseases, we need the development that comes through the companies. One of these very important things is how we can involve, how we deal with the education, the understanding of all these big data and how the patients are going to understand this. So this quadruple helix on one side is very important because it's able to collect, analyze, stratify, and share this health data. But on the other side, it's very important how we deal with the community and with the patients. And if they understand how beneficial this knowledge could be for themselves and for their health, it's very important at the level of each country and of course of the whole EU, how patients are well informed, how they understand the necessity of giving access themselves to the data because they will get back something of what they give to the society. And I think that actually in this moment, the part of the innovation, the whole quadruple helix is around the patient or the volunteer that is involved there. Why I try to underline this fact, because I'm coming from a field that is much related to a specific disease that is cancer. And cancer remains one of the most tragic disease with a very high incidence and very high mortality all over the world. It's more or less something similar with cardiovascular diseases. And what we are looking for in creating these ecosystems in each country and also at European level is to be able to define, and everybody knows that this is a major issue in healthcare, to define some standardized procedure in order to be able to identify, diagnose this kind of diseases very early, considering that at least in cancer, the majority of the patients come into the clinic in late stages where you cannot give them the best treatment. The response to treatment is very limited. The quality of life of the patients is very limited. So facing this big issue, anything that we have now in digitalization, it's far away from being what we need. On the other side, knowing as much data as possible about patients that come from the hospitals, but not only, we will be able to develop that everybody wants to listen, that we are able to provide personalized medicine. So personalized treatment. Even if you are not able to do this for each patient, at least to stratify patients and to be able to generate therapeutic strategies in order that a high number of patients are able to respond to treatment. What is the role of the SMEs here? Let me share with you a very short story. When the pandemic arrived, our laboratory, the genomic laboratory at the university, became overnight one of the labs that was prepared to provide PCR analysis for patients that were infected. We never did it. It was quite struggling. And actually, we were able to finalize the first year of pandemic with 60,000 analysis. This would not have been able to do this if we didn't have a collaboration with an SME that was able to help us immediately in generating a software in which we could put all the data of the patients that were tested, to keep the anonymization of the data, to be able to send all the information in the same day. So we provided the results within 12 hours. So this was, and I think that pandemic changed our understanding and acceptance of the digital transformation, because we saw that looking to small spots in different areas, in different regions, means nothing. And only if we can collect all the data. And I think that one of the major issues that Europe has to consider is how we are going to standardize all the protocols, all the procedures that we are using for obtaining the digital data in healthcare, because there are still countries in Europe that do not have any kind of electronic record of the patients. So I think that it's mandatory to try to find at European level a comprehensive ecosystem that can be like an excellence hub, where each country can provide the data, but also can be very sure that it will take into consideration everything that is related to ethics regarding a specific country. What are the platforms that are used? What are the medical devices that are used? Because there are still big differences between the countries. So,
all right. Thank you there, Joanna. These are already, I will say, quite substantial inputs that you are bringing to our discussion. And I think since you touched upon the role of patient data and how they can serve to indeed drive innovation, and how it's important to have a more unified landscape for the collection of this data at European level, I would like actually to ask a reaction on this to Yelena, also asking how in this respect, when it comes to the need to have a framework for data sharing and data governance, the European health data space can support these efforts and can drive as well the shift towards patient-centric and data-driven health services. Yelena, could you give us your perspective?
Yeah, sure. Thank you. I think what we're currently missing, and partially the European health data space will give us certain answers to that, is the legal environment for health data specifically. How it's regulated and different types of protections, requirements, and so on and so forth. Yes, of course, there is the general data protection regulation. It doesn't go anywhere, and it will be like that. But what is important in this context is to remember that GDPR gives a lot of freedom to the member states to decide on what happens with sensitive types of data, which is health data as well, when it comes to secondary uses, for instance, that it's largely up to the member states to decide of how do they organize it, whether there is consent, whether there is no consent, and so on and so forth. This has advantages and disadvantages, of course. On one side, it saves the national identity of healthcare systems, because all of them are based on different cultural needs, environments, traditions, and so on and so forth. So it kind of saves the uniqueness of each country and helps healthcare services to be targeted to a certain country, because it's still the Union. We're not one country in the EU. But on the other hand, when it comes to research, Of course, it creates a very diverse environment, sometimes unharmonized environment, and sometimes not supportive environment. Because in one country, you might have very easy access to data, in another, it's harder. And we hope that with the European Health Data Space, there will be more answers on how the secondary uses of health data are done within the EU, that it becomes a little bit more harmonized. We cannot say that it will happen in every country in the same way, no, because it's the competence of the member states to decide of how do they organize. So there will be still different types of layers of different laws in the national, regional level even. And the EU law will answer some aspects of that. We also have very big hopes that data processing will become much more standardized. It will help primary level a lot. So in many countries, there might be a requirement to use the same standard for data collection, encryption, and so on and so forth, which is enormously helpful also for research, because then it means that later on there will be much more quality data because simply it was collected in a much better way than it is now. But overall, I would like to think about the EHDS as a first step, I think. There are many more things which have to be done apart from legal environment, but it's also from technological side, from different stakeholders in order for this healthcare digitalization to happen. Because we're not speaking that if, for instance, tonight, the institutions reach some kind of conclusion on the law that we will live in a different world. No, it will take a lot of time, maybe decades, for that shift to happen. And maybe for sometimes we'll even have parallel systems. So the old one and the new one before we finally go somewhere. But yeah, I would like to think about the European Health Data Space as just being one of the steps, but there are many more needs which will emerge and also evolve, because technology is something which constantly changes, and we need to keep up with that as well in the future. Thank you.
Thank you so much, Elena, for these insights indeed. I see also there are some first questions in the chat. We would like to open shortly for a Q&A in a couple of minutes. Before going to look at the questions, could I ask Eric also to react on this need that is coming both from the patient and innovators community to have more standardized systems of data sharing and a better governance framework for data sharing, to share your insights, and also to touch upon one of the aspects you already addressed in your previous intervention on the potentially disruptive impact of technologies such as AI in healthcare. You have led a very important publication of the OECD recently on the topic. How do you see the impact of data sharing and governance on the development of these technologies, and what is the role that small and medium innovators could play there?
Cool, thank you. So my fundamental belief in this space is that the objective of digitalization of health systems should be to activate all members of the public to be active participants in their own care, such that they are empowered with their data and digital tools in order to actually achieve the personal health objectives that they have. Achieving those objectives will certainly be guided by a medical professional, but trying to activate the public as an active participant in their team rather than as a passive member of their own health team, I think should be the objective of our digitalization activities, and is very reflective of everything we've just been hearing so far. It's like the EHDS goes beyond, as I said, trying to protect people with their health data by empowering them to actually take meaningful action. The second thing I would say is I think we actually, oddly, need to move away from terminology like data sharing. And it is a bit of like just being specific about the English words, but the notion of sharing implies I'm giving something to you so that you can do with it what you want. And frankly, it is in that vein, the mentality of data sharing, that people get worried. I'm going to share it with you, and I don't know what you're going to do with it. And I'm worried that you're going to do something that's going to harm me in return. And so I have to have significant challenges associated with it. I think we need to shift our language toward data collaborations, where we are agreeing to partner together to achieve a collective outcome that we both agree we want to get to. And that's where the public, providers, innovators, et cetera, are coming together to agree on how to cooperate and collaborate as a group in order to achieve the collective outcomes that they agree is, I think, where we need to be going. And I think if I look at the United States, for example, they have an agreement that which they call their, quote, Trusted Exchange Framework and Common Agreement, otherwise known as TEFCA, which allows a network of institutions to work together to collaborate on their collective data assets in order to innovate and drive collective outcomes. That's the type of model that I think Europe and other networks should actually think about adopting. And indeed, in an ideal world, there would be some even transatlantic cooperation in that space. But I think that the notion that we have around data sharing agreements as a bilateral agreement between two entities, frankly, is not scalable at the span of what we're trying to do with digital. Effectively, data sharing agreements are appropriate for the linear paper-based age, but we need to move toward the networked digital age. And in that age, it needs to be collaboration as our guiding light. And then that leads me to your last question around what is it that from a harmonization perspective, I think one of the things that I've learned is that for innovators, clarity is kindness, which is to say, it's fine for regulators to regulate, but just make it clear what the rules of the road are. It's when the rules are not clear, when there's ambiguity, when they're subject to interpretation, that there is massive risk for the innovator and for the whole ecosystem in of itself. So I think that having that clarity is absolutely essential. And then the subsequent challenge is if multiple countries clarify what the rules of the road are, but those rules that they clarify are in conflict or really add significant burden, especially to the SME community, I think it's going to really cause harm to the ability to innovate. So I think it is imperative for countries to come together to define their rules of the road. What are the things, what are their requirements for that regulatory environment for innovation? And to the extent that they can, harmonize those practices across countries. And that's a specific area where, from the OECD's perspective, I'm leaning into significantly. Simply put, the mission for the OECD is actually better policy for better lives. And in my view, the better policy is one that is harmonized and collaborative across multiple organizations and countries.
Thank you very much, Eric, for these insights. I see that there are questions coming in the chat about the important role of research within this picture. We are gonna address them in a minute. Before that, I would like to go to Joanna and ask her to react to a very nice expression that I shared, that for innovators, clarity is kindness indeed. And so I would like to ask you, Joanna, working closely with innovators at a regional level, what does a cluster like Cluj IT does to make sure that innovators get this clarity and get opportunities to put their solution at the service of the healthcare sector? Joanna.
Thank you for the question. Well, Cluj IT cluster, of course, it's a big cluster that has not only SMEs, has also academia, has also institute. association, and not all of them are involved in e-health. But we have many SMEs that are very much involved in different projects. We have to remember also that Cluj IT Cluster, it's leading the DAIH for Health in our area, so in Northwest, and where we are providing services for 6 counties. We are participating in European grants, and also we coordinate grants, including information about the secondary use, which I think that it's very important regarding the kindness, because many of the people that receive information about the secondary use of the data, they don't know what we are talking about. So I come back to my initial idea that not only through SMEs that are developing a lot of technology, and it's very easy for them to understand what they are doing, what they are providing. It's very important is who is using this technology. And you know that it's very, let's say, fancy. It's not a good word, fancy, but everybody's looking for different application in which it can improve the health. It can be very well informed about this. And many of these applications are developed through SMEs that have access to different software or that can develop software. So they improve this link between how the digital transformation looks like and what a person can take from this. And I think it's very important that a cluster like Cluj IT to keep this connection with what I think that it's very important for innovation, because many of the ideas that these SMEs are taking from it's coming from academia. We also are involved with Cluj IT Cluster in many contests regarding entrepreneurship, young people, young students, postdocs, and so on, that are developing their own companies, and they come to Cluj IT Cluster to for training, to understand what they can do with their idea, how they can transform their idea in something that is that can bring something for the patient. So this idea of kindness, I think that it's true, one of the most important when we speak about digital transformation. And because you underline 2 things, one, that patients can have access to their own health data wherever they go, let's say in Europe. Maybe it's not enough the fact that they have access. They need to understand these data. And I think that here it's one of the major gaps, at least in countries like Romania, that people are not yet very well informed. And everything we do at the level of Cluj IT is to organize meetings and events and trainings also, in which we try to explain to people how important it is to be a part of this digital transformation in healthcare, because at the end, this will be what we are going to use, all of us, in maybe 10 years or less. Thank you.
Thank you very much, Ioana. And to conclude this session, I would ask each of you to address shortly some questions that we got from participants online, mainly on the role of researchers to contribute to close the gap in healthcare system. What is needed the most to include them in the efforts and the projects that are being conducted, and if any of you has in mind some examples of successful projects that indeed have involved the research and use of healthcare data for health system improvement. And thanks to Rima and Miroslav for posing this question. Who wants to start?
I can start. Because that way I can give others time. Actually, just to the last point that Joanna was talking about. In Australia, for example, more than 90% of Australians have access to their data, but less than 10% of actually use the various access, simply because the form of access the data they have access to is PDFs. It's untrendable and it's hard to actually interpret. So it really is. The objective is not access. It's like how often are people actually using the access to their portals on a monthly basis, and are they actually able to change their direction? In terms of the questions, I would say one example I would use is from the United Kingdom, especially around Health Data Research UK and their trusted research environments that they've set up. There was a paper I'll look it up and I'll drop it into the chat after this, for what are the good data governance rules for trusted research environments. Because I think understanding that and driving that from a research community will actually help you establish environments that actually have baked into it the appropriate data governance practices that are necessary, and the research community advocating for those good practices, I think, is one of the things you can actually meaningfully do to make a difference. And if we all do that together, then we could actually have a level of harmonization across various groups.
Thanks a lot, Eric. I'm looking if Joanna and Yelena would like to react on this topic as well. Otherwise, if I may, I would also add a question to this picture, because we have discussed the importance to have frameworks for health data sharing and involving all the stakeholders, including researchers around the table. And some of these stakeholders actually have raised concerns when it comes to the implementation of the European health data space, because they claim that, if access is easier, then the ones who are best positioned under the condition of the SDS to get this access are often big tech industries that could use this data to develop even further and consolidate their position in the market, and maybe bring a model of concentration of the market to the health sector. Does any of you see a risk in this respect, or with respect to this concern raised also by civil society organizations recently with respect to HDS? Joanna or Yelena, who wants to start?
Well, this is a very sensible question and remark. And I think that whatever we are going to do, considering the security of the data, how much we will take care how to share the data in an appropriate manner and to whom needs to use it. I'm sure that at a certain point, some data will go out, and maybe some companies, or let's say big pharma and so on, will take advantage of this. I don't know if we can control 100% this. On the other side, while this platform that contain health data of patients or whatever in healthcare system are very well anonymized from the beginning, how these companies that will take advantage of the data that escaped from the platform will be very limited. Because if you cannot connect the clinical data of the patient with the information of the patient and many secondary data analysis, you cannot use them. So I think that this is one of the major issues to give access or to create platforms that have their only anonymized data, so that do not contain any personal data that we already know. Of course, you can tell me that at a certain point, someone, at least one person, will know what's about or how to access the clinical data. Yes, but at least we can diminish the risk and the harm that can be done.
Thanks a lot, Joanna. Yelena, any reaction either on the involvement of researchers or on the more sensitive topic of potential concentration of the health market sector?
Yeah, on both actually, very shortly. So I will start from involvement of researchers. I think what is currently might be an obstacle for higher involvement is sometimes lack of clarity on the rules or even lack of understanding of these rules, because not every researcher has legal background on how do they get involved and how can they contribute and how do they share the data as well. Because we should not forget that some research centers sit on enormous amount of data, which also has a lot of value. We speak a lot about individual data, data coming from populations and so on and so forth, but we have a lot of data in industry, in research centers, and we also want this data to be shared, of course, under certain conditions to respect IP rights and so on and so forth. So I think what could help is clear system, which is possibly to be brought up by the European Health Data Space when it comes to health data. Digital, not even digital skills necessarily, but more understanding of the digital environment and big data context when it comes to different types of projects and all of that. So I think it could foster the higher involvement of researchers, and also it could benefit us, different type of civil society group, patient groups, of higher researchers involvement. On the second question, on the big tech company, it is a concern, but aren't it something we are already having? Because if you look at the key providers of technology, they're all based outside of Europe. They're all big tech companies. And I think the myriad of digital laws, not only the European Health Data Space, but different types of other laws coming from the European Union, are exactly aimed to foster our own providers, our own technology, because sometimes we do not have an alternative. Very far away example, but you might have heard about the fact that European Commission is not very, not European Commission, European Data Protection Supervisor is not very happy with the contract between Microsoft and the Commission, saying that it's not really safe for the European Commission to use the whole package of Outlook. But what do? We go to pen and paper in that case if Outlook under certain conditions is not safe. And we should always remember that nothing is absolutely secure, nothing is absolutely safe. So higher level of security is welcome, higher level of anonymization, pseudonymization is welcome, but it does not guarantee that nothing will ever be misused. So together with the law on the system, we also need some clauses in the law on how do we oversight the system, how do we actually see that system protects us, not only citizens, not only patients, but all of us, because if you're a researcher, you also need some kind of protection. If you're a developer, same. So I think the ideal system is the one which is constantly developing and takes into account feedback from the environment, whether it's actually working or not. So for successes, we would need that as well. And it requires a lot of resources and knowledge, I think.
Thank you so much, Elena, for this very straightforward thoughts that I must say at the European Digital SME Alliance we fully share. We have the privilege to represent those innovators that could be part of the solution, also when it comes to bringing to the market alternatives to the existing tools and digital solutions that are already, as you said, used and risking to concentrate even the health sector in the hands of few market players. So we want also a health market that is healthy indeed, and that is competitive, and therefore we believe in this way innovations that come from the European industrial base could contribute to its fullest to the public health objectives and to public policy objectives at large in the healthcare realm. So with this, I would like to thank all of you, Eric, Elena, and Joanna, for this session. It was a very interesting one. I'm sure that we are going to be in touch through the focus group Health and through the next opportunities, because indeed innovation is meaningful if it serves to support the common good, and if it serves to support public policy objectives from institutions, and also the access to health services from the patients. So looking forward to stay in touch. I hope you can stay with us. Otherwise, indeed, we will be in contact. And I would like to move towards a technology-based discussion, I will say, because in the next session, we have the pleasure to have with us two solution providers. Unfortunately, one of the speakers, Victoria Plantower, couldn't be with us at the last minute due to another urgent commitment, but we are very happy to have Marco Pirino, R&D manager at Chimera Group, and Claudia Loro, senior grants manager at Kineticos Health. And in this respect, I would like to start with you, Marco, because Chimera has been the pioneer in Italy for employing digital technologies for telerehabilitation and continues to provide innovation in this sector. Could you please give us an overview of how your company is providing those type of services to the patients and the concrete solutions that improve also the quality of life of the patients you are working with?
Sure. Thank you. Thank you, Antonio. And yes, I will share my screen to present. Okay. Okay. So can you see the screen? Yes, it should be.
Yes.
Okay, great. So we are an Italian company. We are a small Italian company. Good afternoon to all, first of all. Today, I will briefly present you our technologies and how we propose them to the market of public and private health provider to implement rehabilitation and telerehabilitation services. That is, after the COVID emergency, I mean, this topic emerged as a very important aspects, and the interest in this kind of solutions augmented a lot. So first of all, as I said, we are an Italian small company. We are producers of medical devices. All the devices and solutions I will present you in these few minutes are medical device class 1. And our history is quite unusual, because we started as a research spin-off from a collaboration of the San Camillo Hospital in Venice and the MIT in Boston. And from there, and we started our activities in 1998. So we are not, we started quite a few time ago. And from there ongoing, we started with developing our solution hand in hand with the major research hospitals in Italy. They are called IRCCS. It means hospitals that get funded also to do research. And together with them, I would say we developed all of our solutions. I will briefly present. And especially this collaboration was officialized in 2017, when we started the National Health project funded by the Ministry of Health to develop and test and implement an Italian telerehabilitation network for the continuity of care. Obviously, the IRCCS are not our only research partner. We partner with the major research institutions. For example, we partnered a few years ago with the European Space Agency that allowed us to co-develop with them our telerehabilitation solution as an app. This is just one. And right now, our solutions for rehab and telerehab have been implemented, as I said, from the World Network of the IRCCS, grouped in the Italian neuroscience network, in the network of hospitals in Sicily, and in many, many different we call them in Italy ASL, Azienda Sanitaria Locale. That means the local public provider of health services. Our solutions are right now being implemented by many of them with the regional and territorial health project. And we are continuing pushing on that because we think that providing this kind of services to the territorial health provider could be very important. So we are not just talking about research partner, we are talking about a public health provider. And obviously our partners include also private clinics, private hospitals, and physiokinetic therapist rehabilitation centers. This is just an overview of our partners. What we do. We have families of solutions that can be used to provide the rehabilitation rehabilitation treatments to patients from the clinical setting to the home setting. Here, as you can see, you see 7 different devices, things that are the first 2, the one are based in are being used in clinical settings, so in a rehab gym and in orthopedic gym. Then we have a smaller one solution, the same software, the same ideas, but in a smaller form factor for territorial or outpatient rehabilitation centers, or to provide rehabilitation practices for neuropsychologists or speech therapists. Then we have some solution especially devoted to provide rehabilitation at home. So in this case, you see the number 6, the home, that is a sensorized case kit for home use. And then we have an app that is obviously much allows us and allows our clients and the territorial services to provide services to a much wider range of patients, because obviously is a much cheaper solution as well, more simpler and cheaper solution. As I said, all our devices are medical class 1 devices according to medical device regulation, and all of them can be connected to a cloud infrastructures we developed that is GDPR compliant and is being adopted and accepted by the different kind of clients I told you before. The important things the important key elements is that all of our systems are modular systems. Depending on the software modules and depending on the hardware accessories, they can be used to cover a very wide variety of rehabilitation needs. So within a single system, the therapist can treat the patient multiple disabilities and multiple rehab needs during the same session, and also as well as rehabilitate different pathologies with a single unit. And obviously our devices are being, right now we are not just present in Italy, but we are present in many, many different European countries. And we started our expansion abroad 3 years ago, and so our devices can be used to provide rehabilitation in different fields. We talk about neurological patients, orthopedic patient, cardiorespiratory patient, and also oncological patients that need motor, cognitive, and postural rehabilitation in the clinic and at home during their therapist, their therapeutic pathway, and also to recover or to maintain physical and cognitive performance level. So due to the modularity of our devices, we have now within a single device the capability to have more than 20 modules in covering different rehabilitation needs. So we talk about neuromotor, cognitive, speech therapy, postural, cardiorespiratory, and orthopedic modules, along with more specialized, more niche products like, for example, EMG biofeedback, TDCS, and so on. All in all, these 20 modules allowed us to integrate more than 800 clinic exercises in both immersive and not immersive scenarios, which generates visual, audio, and tactile feedback. The general principles where we base our technology are augmented feedback, biofeedback, exergaming, and exergaming in virtual reality if that is proper for a given patient. Virtual reality is just one of the modules we can provide. And the important thing is that we developed all of these exercises and activities together with clinicians and together with researchers at the IRCCS hospitals we collaborate with. This capability allows us also to get a quite strong backup from a scientific point of view. Right now, we have more than 80 papers published that demonstrate the effectiveness or the feasibilities of the methodologies with our solutions, including the telerehabilitation. And here you can see the very, very vast list of different conditions that are being the subject of these publications. I'm just going quite fast because I know we have a few minutes. All of the important thing is that all of the system and all the activities allow the system to collect data in a reporting system, in an extensive reporting system that is fully automated, integrated in real time with the overall workflow of the patient rehabilitation session. The data is always available to therapists in any format, including raw data for research application. In the context of GDPR, we are just entitled as data processor, but the data controller are the clinical units that use our system. Since we have the topics of data safety, data protection has been widely discussed previously. I think it's an important thing to take into consideration. It's a key point to take into consideration. The cloud and the capability of our devices to work in a cloud infrastructure allows, as I said, the system to be used to cover with just one infrastructure, many different centers with different machines and different units in different centers, and to infrastructure also the telerehabilitation services I will show you in a few seconds. Well, obviously, we had to be GDPR compliant. We had to implement all the possible solutions to guarantee the protection of data from infiltration, exfiltration, and in-transit risks. So obviously, our cloud solution has firewall access restrictions. All the personal data and sensitive data and they are specifically anonymized by powerful encryption algorithms. The website and the synchronization services between the machine and the cloud and the web services for therapists are exposed via HTTPS protocol with certificate. And we employ encryption at all different levels whenever possible. So, about telerehabilitation, obviously we started for developing solution for the clinical setting, but then we moved also and we developed also solution, as I said, for telerehabilitation. And we have quite a strong backup right now, the telerehabilitation as a branch of telemedicine, but a quite special branch with with a high level of complexity inside. Can be effective as well as clinical or standard rehabilitation settings. Obviously, this has to be demonstrated for any kind of patient in any kind of condition, and it takes time and research to study that and to eventually, if so, demonstrate that. And but our clinical partners in particular demonstrated that the telerehabilitation with technology can be, if properly implemented, obviously, increase the intensity and the duration of rehabilitation programs, and it is also an opportunity, obviously, for continuous remote medical monitoring. Also, I mean, if properly designed, we have quite a strong indication that the telerehabilitation can be quite well accepted by patients, not also by elderly patients, obviously not by all the patients. It's a thing to be kept into mind. And we all in all, I mean, the telerehabilitation is being quite pushed and quite well accepted by all our clients in order to expand their services and in order to increase the adherence to therapies of their patient when they are not more hospitalized, when they go home. So all in all, the technologies, as I said, allowed us to infrastructure a whole telerehabilitation network of services. At home, what we provide at home, we provide two different, we provide two different technological units. One is this, the commercial name is the VRNS HomeKit, but that's not important. It's a tablet plus sensor in a case, in a already pre-cable case, quite simple to be used. At least we try always to ease at maximum the usability of the system. And the therapist can work with the patient in I mean, telerehabilitation is intended, the meaning of telerehabilitation is usually intended in many different ways. The first way is synchronous telerehabilitation. So the therapist can call the patient and have an audio-video conference with the patient, and the therapist can take the remote control of the device of the patient in order to see what the patient actually is doing, and maybe also to help the patient. Please consider, for example, a puzzle cognitive exercise where the patient has to start with the first piece, and then this is a good option for the patient to be able, for the therapist to be able to use the patient to.
Marco, I'm sorry to jump in, but I think this is extremely interesting, and we will also share in the follow-up of the meeting the presentation with the participants. If I could ask you to summarize in the interest of time, so we can also hear from Claudia.
I've just finished. I was just to start that telerehabilitation with telerehabilitation is possible to connect to the patient, work with the patient, and prepare the personalized treatment plan of the patient, check the adherence of the therapy, and also verify the results of the activities performed by the patient in order to properly readapt the rehabilitation plan for the next phases of rehabilitation. This is happening. This is not just research. This is being used in clinical practice, and this is I mean, I think a viable future for this kind of health services. Thank you for your attention.
Thank you so much, Marco. I think this is a wonderful example of how innovation can be put at the service of the patient and how it can manage to basically create synergies between the different actors that are key in the healthcare sectors, including healthcare providers and patients with different diagnoses. So thank you so much. I'm happy to move forward to Claudia to have yet another example of an SME who is using digital technology to revolutionize care for patients with a strong focus on the use of data, because this is what you do, Claudia, at Kineticos. So we are looking forward also to see how your company is employing use of data and digital technologies to shift towards patient-centric care. Over to you.
Thank you so much, Antonio. I will, first of all, thank you for the invitation, and I've been hearing the previous speakers, and I think we will touch during this panel a lot of things that have been addressed here. I will also share my screen. Let's see. And maybe I will put full screen so that you can see. Okay, I think you should be seeing full screen, right?
Yes, yes, indeed. Thank you.
Okay, so let me introduce. Okay, so let me introduce Kineticos Health. As you were saying, we are a digital health company, and we are specialized in translating human movement into clinical insights. So just to explain a little bit our journey. It began with a simple but I think profound mission of to bridge the gap between the research and the real world impacts. So we were driven by the desire to turn promising results from research to solutions that could really impact people's lives. So that was our driver. And we have now a passionate and dedicated team with different backgrounds and different areas of expertise, and that all contribute to what we do. So, yes. So to explain a little bit what we do, I brought here the example of Parkinson's disease. So as much of you might know, Parkinson's disease is addressed and is monitored in consultation, and during the remaining time, people are left almost alone. So they have their reports and they do their registers, but they are not in contact with the clinician. So there are a lack of continuum and objective data for them to intervene, and they are not empowered to in their condition. So that's where Kineticus entered. So we have with our solution, and I will explain much. I will explain in much detail after what we do, but we will 24/7 monitor patients passively, and I will actively as well, but passively, and we will give them information about many things. That information will also be accessible to clinical partners, to clinical team, the healthcare professionals. They will have that information, and this will allow them to intervene as soon as possible. Imagine that someone is falling a lot and they just have a consultation in 6 months. So their medication is not updated. It's not doing the things it should be doing. So they will have that information remotely, and they can even remotely intervene with the patient. So, and our solution have two different interfaces, if I can call it that way. So we have the mobile solution for patients, and we have the web solution for the healthcare professionals. And to put it simple, our data collection is through 3 different ways. So the first, we continuously monitor passively the user, so he doesn't have to do anything. Of course, he has to have the app to log in, and then he can just put it on the pocket, whatever, and it doesn't have even to be on the screen. So it runs on the background, as we say. So it goes through the day, and we are collecting data. But we can also collect data in 2 other ways, like active tests that can be prescribed by the clinical team, and can be through patient-rated outcomes, also something that the clinical team thinks that it's relevant to assess in a periodic way. So they ask them to do those questionnaires and to assess that kind of information. So with all that information, the clinical team will have a lot of other information they will not access in one consultation in each 6 months or once a year. So currently, our solution is classified as medical device class 2A. And so for all of you that are in this field, you know the challenges that come associated with this kind of certification. And we have passed even through the change in the directive. So it was quite a challenge. But we also have our GDPR IPA compliant for very early stage of our development. And we have all the other important certifications, namely on cybersecurity. We perform penetration tests very often. So just to keep sure that we are safe. But I don't want you to live with idea that Kinetics is only for Parkinson's disease. So yeah, we have been focused much on Parkinson's disease, but it's not only that. So there are other conditions where movement can be an important biomarker. And considering the preventive perspective, Parkinson's disease might be in the tertiary prevention approach, like we aim to soften the impact of an ongoing already condition. But our solution also extends on mitigating identified risks, for example, risk of fall or even any mental condition, but also promoting healthier lifestyles in a primary prevention phase. So like longevity, for instance. Just to give you an example, and just for you to have an idea how the solution looks like, I have here some screenshots. In addition to the different type of data that we are collecting, you will also find in the app the medication register, alerts, chat functionality to interact with the clinical team and the carers. And we have made some customizations related, for instance, in the patient-rated outcomes. As I said, this one was made for a Parkinson context, but yes, it could be different ones. Just to give you an overview of the web, because the other screens were the app and was for the patients. For the healthcare professionals, we have, as I said previously, a web platform. And here I brought a use case because we were working with the PD nurses in the NHS. And one of the questions they put it to us is that like they have 800 patients each to assess. And it might be, as you understand, complicated to decide which one they will assess first and why are they assessing that one and not the other. So we implemented kind of a patient stratification system where we have different colors, and that can help. Based on the metrics they are collecting with our solution, they will stratify patients. And okay, so let's go with Joshua first because it's red. Let's see in detail here in this risk assessment. We can go into details of the different metrics and why he's red. And so this could be very useful it was very useful for these PD nurses, but this can apply to any other conditions. In this case, those metrics were for PD patients, but there are other metrics from movement that can apply to other conditions. So yes, as Mark, I think, was saying, we have also our scientific validated, and we have some interesting publications that you might want to see. And yeah, that's in a nutshell what I had to say about Kineticus. And yeah, if you have any question.
Thank you so much, Claudia. This is yet another example of a company that is already using the potential of data to provide solutions to meet patient needs. So thank you so much for showcasing the potential to your solution. I'm looking if there is any immediate reaction in the participants for questions to either you, Claudia, or Marco. Otherwise, indeed, I think your companies are an example of those innovators that we want to bring together in this community that we are launching today, that is the focus group eHealth at Digital SME. We already have some SMEs who have become part of this focus group, and we are looking at really bringing together the ones that are using cutting-edge technologies to bring innovation tools to provide solutions in this sector. So thank you so much for these presentations. We are gonna be in touch for sure. And of course, I'm already inviting you to join our focus group in order to dive deep into the scope of our focus group and the mission that we want to give to it. I'm happy to give the floor to my colleague Gabriele Casalini, Tech Project Manager at European Digital SME Alliance, who will guide us through the objectives of this focus group indeed. Gabriele, over to you.
Yes, thank you very much, Antonio. So let me just share my screen. Perfect. So a few words on the focus group. We are launching this focus group eHealth within the context of the ShiftUp project in a collaboration with the European Digital SME Alliance. So as you can see, the project has been started since 1 year, and we are building up a strong community of healthcare providers, but also knowledge providers, in innovation intermediaries, and SMEs and public authorities. This is also being enabled by our very strong consortium, which you can see on the screen, and all our network that is creating a very strong community, very wide and across the healthcare sector within all the European countries, with especially some regional clusters and geographical representation given by the partners. So a few words on the focus group. We want to bridge, create a bridge between the SMEs active in the sector, as we have the very excellent examples today in the meeting, but also with private and public healthcare organization and international innovation intermediaries such as cluster, but also as accelerators, and most importantly, to connect them with a pool of patients and to provide a patient-focused innovation. So what is the vision of this focus group that we're launching? We want to create a positive environment. We want to discuss digital technologies, as we have seen today, AI, IoT, and data, but also applications, and how they can be used to address the current challenges in the healthcare sector. So how can ShiftUp, how can digital innovators provide their services better for the interest of the whole patient communities? And what will we focus in this focus group? We have a set of target pathologies ranging from chronic diseases, cancer, mental disorders, cardiovascular disease, and we want to bring the innovators and want to showcase the solution to target these specific pathologies, but not only that. So just a few words on the main features of the focus group, what to expect if you were to join, and what services and what activities we want to promote. So first of all, we know that it's very important to be aware on the funding opportunities, both at national and European level. So we want to prompt a discussion on how to get funding, both private but also public procurement at European level, to develop this new solution for patients. Also, as we have seen today, we want to promote a discussion, a deep dive on actual technologies, especially ICT technologies. How can we use these technologies to supply the needs of the patients? So which best practice can be seen from the sector? Which SMEs, as we have seen today, can we promote in the public discussion? So of course, also we want to talk about the challenges, but also the opportunities, both at European level, at the national level. How can we do better, especially at the level of policymaker? So the focus group will also be a place to discuss the policy initiatives at European level, and which are especially the feedback and the challenges from smaller and medium enterprises. And also the main, one of the main pillars will be how to promote SMEs and also promote the dialogue between the different community. How we can boost the reach of your solution, and we want to showcase some particular use cases, as you have seen today, within a wider community of both public stakeholders, but also especially patients. So, for instance, one of the initiatives we had 2 weeks ago was the first matchmaking event in which we had more than 200 organizations participating, a lot of invitation for one-to-one meetings, matchmaking meetings. So this is one of kind of activities that we want to promote: networking, matchmaking the sector, sharing best practices, and talk about the policy challenges and opportunities at European level. We also want to launch a marketplace in which we can have specific use cases, as you have seen today, to boost their visibility. Bring these use cases as excellent example of European innovation, which reflect our European values, especially giving visibility to smaller innovators that sometimes have difficulty to go international and to have visibility beyond the regional level. So for instance, another very interesting example of activities that we will do within ShiftHub, also supported from all the other partners, especially the University of Cologne. It's a demo day, which will be on the 19th of March, one of many, and many other interesting activities in which we will have practical demonstrations of innovative digital solutions. So as you can see, in this case, we will have Padme, Furaite, and SRDC, which are startups or SMEs that have digital solution for the healthcare sector, are eager to demonstrate that their work and bring them to the market if they are not yet there. So one of the main point of the focus group will also be to give more visibility to the members, spark discussions, and also contribute to the resilience of the healthcare sector. So feel free to check it up on Digital SME website, get in touch with me or with ShiftHub. We are very happy to collaborate and talk with you. Thank you very much.
Thank you so much, Gabriele. And I think now it's time indeed to wrap up our discussions. I think we had a demonstration of how innovation can be crucial to improve the quality of our healthcare systems in Europe, to support patient access to therapies and to health services. And this is a mission that we want to bring on with this focus group to create indeed a community that can deliver on these objectives, that can put together the innovators from small and medium enterprises with the patients in need to improve the quality of the care services that they receive and to meet the needs that they have. We are gonna do that in collaboration with all the stakeholders that we have had the pleasure to have around the table today and participating to this event. So we are gonna work together with the public institutions, with the research sector, with the patient community, of course, because we wanna create synergies to maximize the potential of innovation for this sector. In the next events that we are already planning for the focus group, we are gonna indeed dive in the potential of advanced technologies such as AI into healthcare. We are gonna have the opportunity for SMEs that deploy these technologies to showcase the impact of the solutions they are already bringing to the market. We are gonna discuss about the creation of connected platforms and devices that can foster the experience of the patients with the healthcare systems. And we are gonna indeed have, as my colleague Gabriele just illustrated, several opportunities to connect innovators to scale up the potential of their solutions via matchmaking activities and via specific opportunities to leverage on the potential of innovation that is made in Europe and that is coming from SMEs. So thank you so much to all of you for having been with us today. And we are looking forward for you to become part of our community and to stay in touch for the next developments. Have a nice afternoon to everybody. Thank you so much.